everyone, and welcome to Therafirm Compression at the Handi Medical Annual Conference, virtually of course. We hope that you'd like to join us as we journey through the world of compression. We promise you'll have learned a few things about compression and you'll be ready to offer some of our healthy, beneficial compression products to your patients. So you might be asking, what is compression? Very good question. Compression is the act of applying pressure to certain areas of the body to help increase blood flow. It comes in many different shapes, sizes, and colors and can serve multiple different purposes. Using compression as a medical therapy isn't new. Hippocrates, the Greek physician who is considered the father of medicine, was an early proponent of a rudimentary type of compression therapy. That was BC time, folks. Somewhere between ancient Greece and 2021, some really smart scientists and doctors developed what we know of as medical compression. You might have learned of gradient compression, or maybe you know the term TED hose. These are two types of compressions used for medical benefit. But what is the difference? A great deal, actually. The TED in TED hose stands for thromboembolus deterrent. And if that isn't a mouthful, I don't know what is. TED hose are specifically designed to help reduce the risk of developing deep vein thrombosis or a blood clot in your lower leg. This typically happens after surgery or other conditions that keep you bedridden. These stockings contain low levels of continuous compression that prevent the blood from pooling, encouraging it to circulate around the legs. Promoting increased blood flow prevent these dangerous conditions like DVT to occur. But these types of compression hosiery are not good for anyone who is ambulatory because they do not offer enough support to counter the effects of gravity. That's why we also have gradient compression hosiery. Gradient compression stockings or socks apply the greatest amount of pressure near the ankle. This pressure decreases as it extends up the calf and into the upper leg. This gradual decrease in pressure encourages blood to flow back to the heart, helping to prevent or improve conditions like varicose veins, skin ulcers, DVT, and lymphedema. Gradient compression can also help people who are on their feet a great deal. People who travel, pregnant moms, athletes looking for a healthy way to improve performance and recovery, or anyone experiencing tired, achy legs and needing a boost. Therafirm understands the challenges to patient compliance, which is why our compression products are designed with compliance in mind. We've addressed the biggest challenges to wearing compression in each of our product designs. It's hard to change daily habits, especially if there is considerable effort or discomfort that must accompany the change. That's why getting sizing right is so important. Sizing for compression isn't like sizing for other garments. An approximate fit just won't do. It's important that patients be properly measured for their compression stockings. Our compression socks and stockings fit most wearers in minimal sizes. Most of our products are available in short and long to accommodate a higher range of leg lengths. One of the biggest challenges to patient compliance is the ease of donning and doffing. Let's be honest. Compression garments traditionally are very difficult to put on, especially at the higher compression levels, and no one wants to struggle to get dressed day in and day out. Like its name, Ease by Therafirm offers patients an easier garment to don and doff, and our core spun socks are patented to address this very issue. Both are made with premium ultra-stretchy yarns to allow wearers to put on and remove stockings without resorting to contortions or gymnastics. We promise. Costs can also be a big factor in compliance. If stockings are too expensive, or if they wear out too quickly to replace often enough, patients will be reluctant to continue wearing them. One of the best things about Therafirm branded compression is that they are affordable. Premium quality materials used to make this hosiery hold up better to everyday wear and tear, lasting longer before needing to be replaced. And when they do need to be replaced, they aren't going to strain the wallet in the process. What's the first thing that comes to mind when you think of compression stockings? Is it the rough and scratchy texture of the fibers that so many of them are made of? You won't find that with Therafirm products. We ask a lot of our yarns. Along with the premium stretch, they're also super soft. Our opaque, sheer, and even microfiber yarns are like no compression garment you've ever experienced. Our core spun socks even offer gradient compression in a sock that feels more like an everyday sock. If the lack of comfort wasn't the first thing you thought of, it was probably the lack of fashion. No one wants to be stuck wearing grandma-style stockings every day. Not even grandma likes that look. Our products are made of beautiful yarns in stylish and fashionable colors and patterns. Whether you prefer opaque, sheer, microfiber, or even a more casual everyday sock, Therafirm brands offer the latest fashions. People won't even know that you're wearing compression unless you tell them, because our styles look like hosiery you would choose anyway. This is not your grandma's compression wear. Don't let a compression script pad intimidate you. Let us help you easily navigate through the sheet. First thing first, just like back in school, the patient's name and date go at the top of the page. Next, be sure to jot down the patient's diagnosis. This will help them when referring back to it later. Think about how many pairs your patients will need for everyday wear. Remember that compression has a 6-month lifespan. Keep in mind that you may want to plan for a short time span and then put additional pairs in the refill blank. The patient may need to be remeasured after a few months as their sizing could have changed. The next blank is compression level. Check if your patient needs 15 to 20, 20 to 30, or 30 to 40. Therafirm offers several different brands. Not every brand is right for every patient. Does your patient need open or closed toe? Is a glove, gauntlet, or sleeve more applicable? It's possible they'll need different styles for different needs. Our hosiery is available in knee-high, thigh-high, waist-high, or pantyhose lengths. The patient may have a length preference, or their medical needs may determine what length they need. Finally, add the physician's name and signature to the bottom. That is it. You are ready to roll.
Good afternoon, everyone. My name is Todd McLaughlin. I'm the Vice President of Sales for Therafirm Compression, and I'm very fortunate this afternoon to be joined by Donna Kelly, who is a vascular technologist with a specialty in venous ultrasound. Donna practices at Middlesex Surgical Associates in Winchester, Massachusetts, and is part of the Leahy Health Group. So thanks for answering a few questions for us today, Donna.
Thank you for having me.
Absolutely. So can you tell everyone a little bit about what you do every day in your practice?
Sure. So I do vascular ultrasounds in a surgical private practice. For the last 15 years out of my 25-year career, I've focused specifically on venous disease. So I spend a lot of time doing ultrasound on patients that have problems with their veins, specifically venous insufficiency or varicose veins. Spend a lot of time with those patients, which I think is what we're here to talk about today.
Absolutely. So in that group of patients today, we'd kind of like to focus a little more on the moms, if we could. Sure. Can you tell me some of the common things that you see when moms come in to see you, when they come to see you, what symptoms they might be feeling to decide to come and see you?
Sure. So what we see, what's really common with the patients is we mostly see the patients after they've had babies, honestly. And the common theme with these patients is the more pregnancies they've had, the more babies they've had, the worse their veins are. And the one thing that we have to kind of keep in mind when we talk about veins is the veins, they get worse with the pregnancies, with each pregnancy, is because as somebody's pregnant, their hormones are allowing their veins to overstretch. And there's a reason to that, because they have to have added blood volume for the babies. So, their veins are overstretching, and with more pregnancies, they're stretching, and eventually the veins can't go back to their normal size. And this is why they by the time they're 2 or 3 pregnancies in, their veins just aren't able to rebound back to normal. So this is to the point where they say, okay, I'm ready to do something about this. So they come to see us. And the symptoms that they're typically complaining about are not only visual, which is what some people think. These people are actually suffering from achy, tired, heavy legs that have some swelling that go along with them.
Okay. And what can you and the physician do for them as a solution?
So there's lots of different options, and ultrasound is an important tool because what it's going to do is help us to determine which veins are involved. There's lots of different veins in our legs. Some of the veins we can see, and those are the varicose veins. More importantly, what we need to know is which veins are involved, and that's where the ultrasound comes in. I always talk about veins like they're trees. So the veins that we can actually see are the branches of the trees, and we know the branches aren't working just by looking at them. So my job as the ultrasound tech is to look at the trunks of the trees. Do the trunks work or not? And then which trunks are they? And then what we can do is once we know that, the doctors will look at that and look at the ultrasound and they say, okay, these are the veins that's involved. This type of vein we can treat one way. This type of vein we'll treat another way. And they put together a plan and they go ahead and treat them. Now, the beauty of all of this is in the last 10 to 12 years, the procedures have come such a long way that they're super non-invasive. They're much easier to be done. Most of them are done in an office setting versus a surgery setting. They're about an hour to an hour and a half procedure. Most of them are done without any anesthesia at all, typically a local, and patients are very happy with it. Very little downtime.
Okay. And what's the expectation for the patient after the treatment?
So usually, as far as recovery goes, it's about a 2-week process recovery-wise. And by recovery, I mean, some limitations as far as heavy lifting goes. There really should be no limitations as far as movement goes. So, being a new mom that's very busy with children, there is no real, we don't want you laying down. That's the worst thing you could do. So you want to be up and moving, life as usual is great. So a heavy lifting thing is one of the things that we want to avoid. We also want to avoid any kind of exercise that involves any abdominal work. So that's one of the things that, we kind of stress. Other than that, walking is great, moving is great, any kind of cardio is excellent. And that's one of the things that keep people from wanting to actually, do these surgeries because they think they're going to be limited in their mobility, and they're really not. So it's not something that should keep you from investigating having these procedures done. One of the things that you do have to do, and you should have to do after these procedures, is compression. We suggest that you, and some require that you wear compression after the procedures for a little while to make sure that the veins heal nicely like they're supposed to. The recovery is pretty simple as far as how the veins look and how you feel. Within 2 weeks, your symptoms will pretty much be gone. They're tired, achy, and heavy. The legs feel much better. Visually, it takes a little bit longer. So you're looking at, usually we say, could take up to about 3 months to see the maximum result of these procedures. And then you can slowly start to work on some of the more cosmetic ends of it. But by 3 months, you'll see the maximum result, and then you can go from there as far as cleaning up whatever's left over.
Wow, that's great. How many patients do you guys say that you treat in a month? Is this a very much more frequent type of thing, or is it pretty rare?
No, it's pretty frequent. I mean, I could fill almost every day with varicose vein patients, I guess we could call them,
Wow.
And we could fill, we do our vein procedures on Fridays, and we could probably fill a whole day every Friday with vein procedures. It's very common, and it's not just women, it's men as well. But because of the hormone situations and the pregnancies, it's certainly more prevalent in women.
Okay. Well, thank you so much for talking to us today. We really appreciate your time. Thank you so much.
Oh, it's my pleasure. Thanks for having me.
Now you know everything there is to know about compression and Therafirm branded compression hosiery, right? Just kidding. But you've got the basics to get you off on the right foot, pun intended. We hope that you'll turn to Therafirm and Handi Medical to help you with all your compression questions and compression needs.